Main health problem: Clostridium difficile infection, C. diff, a severe bacterial infection of the colon that disproportionately affects older adults, particularly those who have recently taken antibiotics or been hospitalized. Main promised solution: comprehensive understanding of C. diff, including how it develops, who's at risk, warning signs, and evidence-based prevention strategies. Why this problem is dangerous for seniors. C. diff is not just another stomach bug. For adults over 60, this infection carries a 65% higher mortality rate compared to younger patients. The infection causes severe, watery diarrhea that can lead to life-threatening dehydration, toxic megacolon, bowel perforation, and sepsis. Each year, nearly 500,000 Americans contract C. diff, and approximately 29,000 die within 30 days of diagnosis, with seniors representing the vast majority of these deaths. Why this solution matters? Knowledge is your first line of defense. Understanding C. diff empowers you to recognize early warning signs, advocate for yourself in medical settings, and implement prevention strategies that could save your life. Recent research shows that informed patients reduce their C. diff risk by up to 40% through simple protective behaviors. Opening hook. Margaret was a healthy 68-year-old grandmother. She went to the hospital for a routine knee surgery. 3 days later, she was fighting for her life. Her enemy? A bacterium called Clostridium difficile, C. diff for short. Every year, this single infection kills more seniors than car accidents. And if you've taken antibiotics in the last 3 months, your risk just increased 20-fold. Today, I'm going to show you exactly what C. diff is, why it's so dangerous after age 60, and the 5 warning signs that could save your life. The problem. Let me start with something that might surprise you. Right now, your intestines contain trillions of bacteria. Most of them are helpful. They digest food, produce vitamins, and protect you from harmful invaders. But Clostridium difficile is different. This bacterium produces 2 powerful toxins that attack the lining of your colon, causing severe inflammation and damage. The result? Watery diarrhea, often 10 to 15 times per day, severe cramping, fever, and potentially life-threatening complications. Now, here's where age becomes critical. A 2023 study published in the Journal of the American Geriatric Society found that adults over 65 are 8 times more likely to develop C. diff than younger adults. Why? 3 reasons. First, as we age, our beneficial gut bacteria naturally decline, leaving room for C. diff to take over. Second, seniors are more likely to take antibiotics, which wipe out the good bacteria that normally keep C. diff in check. Third, hospitalizations and nursing home stays expose you to C. diff spores that can survive on surfaces for months. Lean in, serious. Margaret's story? She received antibiotics during her knee surgery. Those antibiotics killed her protective bacteria. Within days, C. diff colonized her colon. She spent 28 days in the ICU. The danger. Let me be direct about what makes C. diff so dangerous after 60. Danger number 1. Rapid dehydration. When you're losing fluids 15 times a day, your body can't keep up. For seniors, this means kidney failure, electrolyte imbalances, and dangerous drops in blood pressure, sometimes within 24 hours. Danger number 2, toxic megacolon. In severe cases, the inflammation becomes so intense that your colon swells and stops working. This condition is called toxic megacolon, requiring emergency surgery and carries a 50% mortality in seniors. Danger number 3, recurrence. Here's the cruelest part. Even after successful treatment, C. diff returns in 25% of patients, and with each recurrence, your risk of death doubles. Pause. Compassionate tone. A 2024 study from Johns Hopkins found that seniors who experience recurrent C. diff have a 5-year mortality of 57%. That's why early recognition is everything. The solution. The 5 warning signs you must know. If you or a loved one experience these symptoms, especially within 3 months of taking antibiotics, you need medical attention immediately. Warning sign number 1, watery diarrhea. Not just loose stools, we're talking watery diarrhea 3 or more times in 24 hours that doesn't improve after 48 hours. Warning sign number 2, severe abdominal cramping. Pain that comes in waves, particularly in the lower abdomen. Many patients describe it as gripping or twisting. Warning sign number 3, fever, a temperature of 100.4 degrees Fahrenheit or higher, especially when combined with diarrhea. Warning sign number 4, blood or pus in stool. This indicates severe colon inflammation and requires immediate emergency care. Warning sign number 5, rapid heart rate and weakness. These are signs of dangerous dehydration and possible sepsis. Direct to camera, firm. If you have 3 or more of these symptoms, do not wait. Go to the emergency room. Protection strategies that work. Now let's talk about protection. Strategy number 1, question every antibiotic. When a doctor prescribes antibiotics, ask, is this absolutely necessary? Research shows that 30% of outpatient antibiotic prescriptions are unnecessary. If antibiotics are required, ask for the narrowest spectrum option for the shortest duration. Visual, hand washing demonstration. Strategy number 2, master hand hygiene. Alcohol-based sanitizers don't kill C. diff spores. You need soap and water, scrubbing for at least 20 seconds. This is non-negotiable if you're visiting someone in the hospital or living in a care facility. Strategy number 3, probiotic protection. A 2023 meta-analysis in The Lancet found that taking specific probiotic strains, particularly Lactobacillus rhamnus GG and Saccharomyces cerevisiae, during and after antibiotic treatment reduced C. diff risk by 60%. Visual, healthy foods on table. Strategy number 4, feed your microbiome. Foods rich in prebiotics like garlic, onions, asparagus, and oats feed your beneficial bacteria. Think of it as fertilizer for your internal defense system. Strategy number 5, hospital advocacy. If you're hospitalized, insist that all healthcare workers wash their hands before touching you. Don't be polite about this. Your life depends on it. Resolution. Remember Margaret? After 28 days in the ICU, experimental fecal microbial transplantation saved her life. Today, she's cancer-free from C. diff for 3 years. Compassionate, hopeful tone. But here's what she wants you to know. She wishes she'd recognized the warning signs sooner. She wishes she'd questioned the routine antibiotics. She wishes she'd understood her risk. Direct to camera. You now have that knowledge. C. diff is serious, but it's not invincible. Armed with awareness, prevention strategies, and early recognition, you can protect yourself and the people you love. Call to action. If this information could help someone you know, especially anyone over 60 who's recently been hospitalized or taken antibiotics, please share this video with them right now. And subscribe to this channel for more evidence-based health information that could save your life. Visual text overlay with key resources. I've put links to the scientific studies I mentioned and C. diff resource centers in the description below. Final frame, warm smile. Stay informed, stay healthy, and I'll see you in the next video.